10 warning signs and symptoms of pancreatic cancer you shouldn't ignore. Hello, welcome to the Health Life YouTube channel. Yellow eyes, itchy skin, persistent stomach ache, and weight loss shouldn't be taken lightly, as these symptoms may indicate pancreatic cancer. Pancreas is an organ that is located behind the lower part of the stomach and aids in digestion and also metabolism of sugar. Pancreatic cancer, a rare kind of cancer, normally begins in the lining of the ducts of the pancreas. There are rarely any early signs of pancreatic cancer, and when they do appear, the cancer has usually advanced. This is because the pancreas is deep inside the body, and early tumors can't be detected during routine examinations. Smoking, diabetes, chronic pancreatitis, inflammation of pancreas, family history of pancreatic cancer, and certain genetic syndromes can increase your chances of pancreatic cancer. There are signs like yellow eyes, itchy skin, persistent stomach ache, and weight loss that could indicate pancreatic cancer and that people shouldn't take lightly. According to cancer.net, the cause of pancreatic cancer is often not known, and a person with an average risk of pancreatic cancer has about a 1% chance of developing the disease. Most pancreatic cancers are considered sporadic, are also known as somatic mutations, which means the genetic changes that led to cancer may develop by chance after a person was born. However, there is no risk of passing these genetic changes on to one's children. Dr. Bursing Serawat, Director and Shodhi, Gastroenterology, Marengo QRG Hospital. Faridabad talk about warning signs and symptoms of pancreatic cancer people should know. The most common warning signs in patients with pancreatic cancer are pain, jaundice, and weight loss, says Dr. Serawat. He also elaborates on other warning signs to watch out for. 1. Persistent abdominal pain. Don't overlook persistent abdominal pain, as the pancreas is stationed in your abdomen behind your stomach. Owing to it, the patient experiences a dull pain in the stomach, mounting pressure on the organ. Later on, it can turn more painful and persistent. It's considered the most common symptom of pancreatic cancer. 2. Back pain. It is also reported common, but it occurs when the cancer radiates to the nerves surrounding the pancreas. You should consult a doctor, especially when it's occurring often. 3. Itchy skin. There are many causes of itchy skin, and pancreatic cancer is one of them. The itchiness develops when bilirubin is built up in the skin, and the skin color turns yellow owing to jaundice. 4. Unexplained weight loss. There are various reasons why weight loss can signal pancreatic cancer. As the cancer advances, it eats up the energy of the body, making you lessen weight. Due to the tumor pressing on your stomach, you may feel full. Also, when your pancreas does not function properly, it may not be able to make enough of the digestive juices needed for your body to process nutrients in the first place. 5. Gastrointestinal issues. If you experience light-colored, oily, or watery stools or foul-smelling stools when your bathroom habits are okay, then it may be an indication of pancreatic cancer. This kind of issue arises when the bile duct is obstructed, which stops bilirubin from getting to your stools and makes it difficult for your body to digest fats accurately. 6. Yellowing of the skin and eyes. If your skin and eyes turn yellow, you should never ignore it. Conditions such as liver disease and hepatitis may cause jaundice. It may also go hand in hand with pancreatic cancer, as a small tumor in the very end of the pancreas can become the cause of jaundice. 7. Dark urine. If your skin and eyes turn yellow, you should never ignore it. Conditions such as liver disease and hepatitis may cause jaundice. It may also go hand in hand with pancreatic cancer, as a small tumor in the very end of the pancreas can become the cause of jaundice. 8. Sudden onset of diabetes. If you develop diabetes abruptly at an older age, don't take it lightly. Pancreatic cancer may cause sudden onset diabetes or late onset diabetes as it destroys the cells that make insulin, leading to blood sugar levels to jump up. 9. Blood clots. When a blood clot forms in a large vein, deep vein thrombosis, it may sometimes be the first sign of pancreatic cancer. It usually appears as redness, swelling, and pain in the leg which has the blood clot. A piece of the blood clot may also travel to your lungs, making it hard to breathe. 10. Unexplained fatigue. If you feel extremely tired without any reason, you should consult your doctor. Pancreatic cancer and all cancers can also make you feel immensely exhausted and impact your usual daily activities. A diet beneficial for pancreatitis may be rich in fruits, vegetables, beans and lentils, whole grains, lean meats, fish, and healthy fats such as medium-chain triglycerides, MCTs. Certain foods may make abdominal pain caused by pancreatitis worse. It is important to choose foods that will not make symptoms worse and cause discomfort while recovering from pancreatitis. Best foods to eat for pancreatitis. The first treatment for pancreatitis sometimes requires a person to refrain from consuming all food and liquids for several hours or even days. Some people may need an alternate way of getting nutrition if they are unable to consume the required amounts for their body to work properly. This can involve specialized oral nutritional supplements, liquid nutrients administered through an IV trusted source, or a combination of methods. When a doctor allows a person to eat again, they will likely recommend that a person eats small meals frequently throughout the day and avoids fast food, fried foods, and highly processed foods. Here is a list of foods that may be recommended and why. Vegetables, beans and lentils, fruits whole. Grains, other plant-based foods that are not fried. These foods are recommended for people with pancreatitis because they tend to be naturally low in fat, which eases the amount of work the pancreas needs to do to aid digestion. Fruits, vegetables, beans, lentils, and whole grains are also beneficial because of their fiber content. Eating more fiber may lower the chances trusted source of developing gallstones and acute pancreatitis. In addition to fiber, the foods listed above also provide antioxidants. Pancreatitis is an inflammatory condition, and antioxidants may help reduce inflammation. Lean meats and fish. Lean meats can help people with pancreatitis meet their protein needs. Some examples include skinless chicken or turkey lean or extra lean ground chicken, or turkey 95% lean ground beef loin, or round cuts of beef or pork. Certain types of fish are also lower in fat while providing plenty of protein. These include whitefish, such as cod or haddock, and canned fish packed in water, not oil. Some research trusted source suggests that eating approximately 2 to 3 servings of fish per week may even help to prevent non-gallstone-related acute pancreatitis. Medium-chain triglycerides, MCTs. Chronic pancreatitis is a long-term condition that can make it harder for the body to absorb nutrients from food. If dietary changes and medication are not helping a person to absorb enough nutrition, a doctor may prescribe oral nutritional supplements to help a person gain weight and get the nutrients they need. According to the European Society for Clinical Nutrition and Metabolism, ESPN, oral nutritional supplements containing medium-chain triglycerides, MCTs, may be helpful for some people with chronic pancreatitis. However, these supplements are not the same as MCT oil products that people may purchase to pursue weight loss or fitness goals. MCT oil is a type of fat, and it may not be suitable for everyone. For example, people recovering from acute pancreatitis may be advised to follow a low-fat diet that limits added fats. With pancreatitis, A person should only consume supplements containing MCTs under a doctor's advice. List of foods to avoid with pancreatitis. Alcohol. Drinking alcohol during an acute pancreatitis attack can worsen the condition or contribute to chronic pancreatitis. Chronic alcohol use can also cause high triglyceride levels, a major risk factor for pancreatitis. For people whose chronic pancreatitis is caused by alcohol use, drinking alcohol can result in severe health issues and even death. Fried foods and high-fat foods. Fried foods and high-fat foods, such as burgers and French fries, can be problematic for people with pancreatitis. The pancreas helps with fat digestion, so foods with more fat make the pancreas work harder. Other examples of high-fat foods to avoid include high-fat dairy products, such as cream, whole milk, and full-fat cheeses, processed meats, such as hot dogs and sausage mayonnaise potato chips. Eating these types of processed high-fat foods can also lead to heart disease. Refined carbohydrates. Registered dietitian Deborah Gersberg recommends that people with chronic pancreatitis limit their intake of refined carbohydrates, such as white bread, sugary snacks, and sweetened drinks such as soda. Refined carbohydrates can lead to the pancreas releasing larger amounts of insulin. Foods that are high in sugar can also raise triglycerides. High triglyceride levels are a risk factor for acute pancreatitis.